So the question is, does Medicare cover heart attacks? And what most people want to know is how much will they pay if they have a heart attack? Does it cover it? Does my doctor or hospital cover it? And the answer to that question is pretty simple if you look at Medicare in two different directions. So I always tell people Medicare actually has two different choices: Medicare Advantage plans and Medicare supplement plans. And in this video, I'm going to explain to you what the best plan to have if you were to have a heart attack. My name is Brian Monahan. I've been working with people on Medicare for the past 15 plus years. I'm a licensed insurance agent in 48 states, and I work with people around the country, getting them on the best plan for their zip code and for them. Now, if you were to have a heart attack, I can tell you, if you look at the screen, you're going to want to be on one of these two plans, in my opinion, Plan G or Plan N. Now, the reason why it's so important, because these two plans, number one, you're not going to pay much if you were to have a heart attack, and I'll get into the numbers. As you can see, I have a chart on the screen. And number two, these plans do not have networks. What that means is any hospital or doctor that accepts Medicare, original Medicare that you see on the screen, the red, white, and blue card, has to accept any company with their Plan G or Plan N. So that would include AARP, Aetna, Medico, Cigna, any Humana, any company that you can think of that has a Plan G or a Plan N will be accepted if the hospital or doctor accepts Medicare. Now, some companies are better than others, and I'll talk about that also, but you need to know if you were to have a heart attack, G or N, or F, if you're a little bit older, is the plan that you're going to want to be on. Now, let's dive into a little bit about the numbers. Now, most people are going to pay $174.70 to the government each month to be on Medicare Part A and B. That's that red, white, and blue card that you see at the left-hand side of the screen. On top of that, you're going to pay for your Medicare Supplement Plan G and Plan N. Now, sometimes Medicare Advantage plans are zero premium plans, but I could dive into what the problems are with these plans. And I've had many people on these plans that have told me my doctor was out of network, it wasn't accepted at this hospital, they overcharged me for certain things that I had done. They did not cover certain procedures that I wanted to get done. I called ahead and said I needed to get this done. They did not approve it. These are the things that happen when you're on a Medicare Advantage plan. When you're on a Medigap or a Medicare Supplement Plan G or N, this does not happen. How do I know this? Because I have 1,000 clients that I deal with throughout all over the country in 48 states, and I do not get phone calls from any of them saying, this happened to me, I was not covered, I couldn't go to this hospital, I couldn't go to this doctor, why was my skilled nursing not covered? Those, I do not get that. With the Medicare Advantage plans, I do get phone calls from people saying, I was on this Advantage plan, I was turned down for this specific procedure, and I want to get on a Medigap plan. And I say, good for you, because that's the right choice. So if you look at someone who's 65, on average for a Plan G, they're going to pay $140 a month. That's on top of the $174.70. Now here's the thing, you're going to pay that $174.70 with a Medicare Advantage plan also. So no matter what, you're paying that. Then you're paying an additional $140 for a Plan G or $106 for a Plan N. Now those are averages. I have written a lot of Plan Ns, especially in the last 6 months, where it's been under $100, $85 a month, $90 a month. And I'll get into what these plans cover, but they're absolutely fantastic. If we stay on heart attacks, if you're on a Plan G or a Plan N, most likely you're going to pay nothing for that initial, the hospital visit, skilled nursing, whatever it is. The only thing that you're going to pay for is going to the doctor, most likely afterwards, when you go for doctor visits and checkups, and to your cardiologist. And those visits are either going to cost you nothing or they're going to cost you up to $20. So these are the two plans that you're going to want to be on. So the question is, how much will a heart attack actually cost me, and will it be covered? If you're on one of these two plans, if you're on a plan G, the most that it would cost you would be $240 for that heart attack. That would be the deductible that plan G has. Other than that, you're not going to pay anything. Now let me slide down. You're not going to pay anything, as you see, for doctor and specialist visits, your cardiologist, whoever it may be. Urgent care, ER visits, you're not going to pay anything. CAT scans, and as you can see all the way down, you pay zero for everything on Plan G except for that $240 deductible in 2024. So basically, you can take your premium, whatever it may be, and it's going to be different for every zip code, whether you're a female or male, and your age, but you take, and the company that you choose, and you take that premium, and then you multiply it by 12, add on that 240, and that's what you're going to pay for the entire year. It doesn't matter if you have a heart attack, stroke, whatever it may be, that's going to be your maximum out of pocket. So people ask me, what's the maximum out of pocket? Well, Plan G, it's very easy. That's going to be your math. Your premium times 12 plus the 240, and that's all you're going to pay medical-wise. For Plan N, there's a couple of differences. They have that same $240 deductible, but then the only thing you're going to pay is up to $20, and I said up to $20, so it could be 10, it could be 0. That's going to the doctor or the specialist. Now, the other thing is going to be a $50 emergency room fee if you go to the emergency room fee, which is waived if you get admitted into the hospital. The third and final difference is going to be what they call an excess charge. If a doctor does not accept Medicare's payment, they can charge up to 15% on top of what Medicare's allotted payment is. Now, the one thing I want to say is this is not for hospital stays. This is a Part B excess charge. So people say, well, I don't want to pay an extra $50,000 for this. Well, there's two things. Less than 2% of the doctors in the country charge this excess charge. I always say to people, I have had nobody ever in 17 years call me on that's been on a Plan N in all the states that I'm licensed in and say, I received an excess charge. It has never happened. And in these videos, I hope I can keep saying it has never happened. I don't even want it to happen once, but I'm not the only agent that it's never happened to. So Plan N is 50% of my clients are getting on Plan N. It is spectacular. Like I said, if you were to have a heart attack, you want to be on Plan N or Plan G, without a doubt. If you look at some of the math down here, if I scroll down, if you went to the doctor 6 times and the ER once, you're still going to pay less for the Plan N than you are for Plan G. But I don't want to push either one of these plans more than the next because I love both of these plans. If you're healthy, I always tell people you might want to think about Plan N because it's going to cost you less in the long run. But if people are unhealthy or if they've had heart problems, a lot of times they want to choose a Plan G and say, forget it, I just want this, pay my premium, and boom, I don't have to think about copays or anything. And I can understand that because it can be daunting going to the doctors trying to keep track of what you're paying each time and over a year's time. That's pretty much it. I don't even want to discuss the Medicare Advantage plans because I've had so many horror stories where people say I've had heart attacks or strokes and I couldn't go here for my skilled nursing. Here's the big thing, and I know I'm talking a little bit fast in this video, but let me scroll up. Biggest thing for heart attacks, strokes, and all these different things, not only is hospital, but it's skilled nursing. You get 100 days at zero cost with a Plan G or a Plan N. When you're on an Advantage plan, you get 20 days. And I've seen it so many times where people have literally gotten rolled out of skilled nursing and said, thanks for being here, but that's it. Your 20 days are up. Goodbye. With Medicare Supplement Plan, you get 80 more days at zero cost to you. Plans are absolutely fantastic. Once again, it doesn't matter AARP, Aetna, Cigna, Humana. What we do is we look at your zip code, what the costs are, give you the price breakdown of all these different companies. We don't charge anything on top of the companies. So it's not like the companies say it's $100 and then we say, well, charge them $150. That's illegal. So you're going to get the exact price of what the plan is. But if something major like a heart attack was going to happen and you are on one of these plans, you are really going to be thankful. Thanks so much for watching the video. Once again, my name is Brian Monahan. My number's on the screen. If you have any questions, please give me a call.